My name's Elizabeth Ropes. I am the Community Outreach Coordinator for St. Jude within their Infectious Disease Department through the Community Outreach Division. So EHE, it stands for Ending the HIV Epidemic. It's a national initiative that came out in 2019. So the goal is to reduce new infections to 75% by 2025 and by 90% by 2030. We receive funding from Tennessee Department of Health. Tennessee Department of Health also funds an organization called United Way of Greater Nashville. So they are the lead agent that recruit these agencies that get funded for EHE. So those agencies like PEAS, Hope House, OUTMemphis, A Betor Way, University of Tennessee Health Sciences. Then you have other organizations such as Methodist Le Bonheur Community Outreach, who is under Le Bonheur Children's Hospital. So we recruited all these agencies because they are doing the work, and we want to see them continue doing the work to make an impact.
Hello, I am Rosa Barber. I am with Partnership to End AIDS Status. Our nickname is Peace Inc. And our mission here in Shelby County, Tennessee is to offer interdisciplinary services and education to underserved communities, providing free confidential HIV testing, hepatitis C testing, education. We help to link those who are HIV negative to care. We also help link those who are HIV positive into care, and we offer them holistic opportunities.
My name is Tamika Wren. I work for Hope House Memphis. I'm the Director of Outreach and Linkage Services. Hope House was started about 27 years ago to provide child care services for individuals that was affected by HIV. So we have one of the only child care centers in the state of Tennessee, actually. We have expanded to also provide HIV testing, social services, therapy, individual counseling, food pantry. We provide a host of services from child care to elderly services.
So my name is Drew Armstrong. I'm a clinical pharmacist with the University of Tennessee College of Pharmacy, and I teach pharmacy students and pharmacy residents from the University of Tennessee.
My name is Dr. Crystal Walker. I'm an assistant professor with the University of Tennessee Health Science Center in the College of Nursing. And then the UT Health Science Center mission is to improve the health of Tennesseans and the global community. And one of the ways we do that is through the education of our health professional learners. And so our goal is to provide high quality education so that our learners, such as nursing students, pharmacy students, physical therapy students, they can go out and take that education and make improvements to the communities that they serve.
When we heard about the funding, we were super excited. We saw the availability to close some of the gaps that we experience on a daily basis with working to get individuals virally suppressed and making sure that they are staying in care and they fully understand how to do that on their own. We provide a concept where people can come in and experience what HIV looks like from a child that was potentially born with it or affected by it. And we tend to get a lot of people who work with us to understand that, and then they go back into the community and have those very hard conversations. Helping to reduce stigma is one of the things that will get our communities to zero. It's one of the things that's huge in our area, and so I think the stigma reduction, bringing in partners that are just not usual, not the norm, right? We want everyone at the table having this conversation, making it a very normal conversation about sexual health and HIV.
New infections are continuing every day because of people are not engaged into care, people are not taking medication, people not wanting to get tested.
We have to look at the populations here in Memphis, where it's 85% BIPOC individuals that's here, and half of those are living in poverty. So they're unable to make it to doctor's appointments. They're unable to afford medications. They don't have transportation. They have to work. So it's our responsibility to come up with creative ways to get those people to be comfortable enough to say, hey, I'm gonna do something about my health, and I want to make that change. Everybody know how you get HIV. What's the next step once we are educating? What's the next step to get people excited about getting into care? What's the next step about getting those who are remaining negative excited to get on PrEP?
PrEP is one of the ways that we can end the HIV epidemic. And for people who don't know what PrEP is, it's a medication that people who are at risk for HIV can take to prevent them from getting HIV. And so that's just one of the ways we can end the epidemic. But PrEP is not a medication you can just walk into the pharmacy and buy off the shelf. Like, it has to be prescribed by a licensed professional. And so in a way, healthcare professionals are the gatekeepers to PrEP. And so we want to make sure that healthcare professional learners know what PrEP is, because if the healthcare professional doesn't know, then they're not going to talk about PrEP with their patients. And so we apply for EHE funding to start a PrEP boot camp.
So we want to start this PrEP boot camp really to kind of teach our pharmacy learners, our nursing learners, our medical student learners about PrEP and how they can have an impact on this patient population. And so through the grant, we're going to be able to have these 8-hour day boot camps with really professionals from all aspects of healthcare coming and talking to them about how to talk to your patients, what is PrEP, how to have those uncomfortable sexual health conversations with your patients. And so with the ability of the grant, we're going to be able to have these professionals come in, teach the students over this 8-hour day, and really hope they'll take away from that and then be able to care for their patients as they graduate and go out into the real world.
I think that Shelby County can get to our goals. We can reach the masses, but we have to come together. We have to show the world what Memphis and Shelby County can do by ending the epidemic.